For everything lesbian, gay, bisexual and trans in the borough of Stockport and beyond, Under the Rainbow on Pure 107.8 FM. Cancer Doesn't Do Labels is a study day which hopes to improve understanding amongst healthcare staff about the issues regarding trans people and cancer. It will be at Wythenshawe Hospital on Tuesday. Earlier we heard from Ben Hewitt from the LGBT Cancer Support Alliance. Now we're chatting with Tara Hewitt, who is the Equality, Diversity and Inclusion Lead at University Hospital South Manchester NHS Trust.
I think it's really important that all NHS trusts tackle the health inequalities that exist across the UK. I know Manchester in particular has health inequalities as a city based on the outcomes for everybody in Manchester. But trans people face particular challenges and barriers around certain health issues like cancer. And I think if we're really serious about improving the health of all of our community, that we do work on that. I know as a hospital, we've said we're really committed to making sure that trans inclusion is high on our list of priorities around equality and diversity, and hopefully hosting this event and supporting organisations like the LGBT Cancer Alliance, the LGBT Foundation, Action for Trans Health, shows how committed we are to that agenda. In Manchester, there's going to be roughly 13,500 trans people who experience cancer in their lifetime, and I think it's our responsibility and other trust responsibility that we take the issue seriously.
Why do you think that they face additional barriers when it comes to healthcare?
I think there's still a lot of research that needs to be done around trans health issues. Unfortunately, that hasn't been an area where the research funding has been directed in the past, and I think that's something that we've all got to look at in the longer term. But from what we do know, trans people face more barriers around social exclusion, around economic status, with 20% of the trans community being unemployed in the UK, and we know that those factors for anybody lead to increased rates in cancer and health concerns. And you add to that the negatives and experiences of discrimination that we know trans people face around primary care. We've seen over the last couple of years a campaign which was called Trans Doc Fail, which in the end the GMC took up to highlight the negative experiences trans people had accessing their GPs. And so trans people are afraid to access primary care because of those negative experiences. So if you're not going to have health checkups and screening and you're not getting that health information, that has a knock-on effect when it comes to long-term health issues. And I think we've all got to start to address those concerns wherever we are based within the health system.
Do you think that this event is going to go far enough in terms of reaching healthcare professionals? Because I suppose there's still a lot more out there who will be quite ignorant of trans issues.
I think this can't be the only thing that we do, and I know that we're committed, as I said already, as a hospital to do a lot more ourselves around trans inclusion, and I've already been meeting with trans organisations to look at those pieces of work across different aspects in the hospital. But that's why, like I said, why we're committed to the LGBT Cancer Support Alliance, which is a network of health professionals, trans people who've experienced cancer, academics and third sector organisations who have got a sustainable agenda to improving trans issues as a system right across Manchester. I know recently in Manchester, over the last 12 months, both Stockport and Wigan have hosted the two biggest ever trans health conferences in the UK. So regionally, we're really taking a lead on this, and I hope that it does continue, and I know colleagues here are really committed to that. I just think it's important that we put the message out that we do want to listen to trans people. I think that being trans myself, I've had a lot of negative experiences when I've accessed health services in different parts of the country, and it can put you off engaging and wanting to talk and share your experiences. But I'm hoping that events and activities like this, and over time, that we can rebuild that trust and actually really involve trans people in the future of health services rather than just hearing the negative stories that we hear.
If you'd like to attend the event, there's a listing on Eventbrite. We've got a link to it on our Facebook page, or you can search in your web browser for Cancer Doesn't Do Labels. You should be able to find the details on the Trust's website as well, which is www.uhsm.nhs.uk, or find the details on LGBT Cancer Support Alliance's Twitter feed, which is @LGBTCancerSA.